So today we'll be discussing about a very interesting question, that is the use of proton pump inhibitor, that can be injection pantoprazole or omeprazole into upper GI bleed. So whenever we see upper GI bleed, here we are talking for stomach ulcer bleed. So we must know that most of the patients who present with hematemesis or melena, most of the time hematemesis only, so they can definitely potentially have stomach ulcers. And the other reason is esophageal varices. So esophageal varices we'll be discussing in some separate topic. But for stomach ulcers, we know that these stomach may have ulcers because of the peptic ulcer or gastric ulcers. These patients may have these ulcers. So because of the acidity, very commonly these ulcers may bleed, and they may bleed into the stomach. So, in those patients who are presenting with hematemesis or melena, where we suspect stomach ulcers, we use injection proton pump inhibitor. Mostly, we use injection pantoprazole, and what we give is we give 80 milligram of injection pantoprazole as IV bolus, and we continue at the rate of 8 milligram per hour till the hematemesis or melena is completely stopped, till the patient is hemodynamically stable. Now, what is the rationale behind this? As we know that wherever the stomach has the stomach ulcers, though whenever there is injury to the stomach ulcer because of the alcohol, because of the smoking, because of the acidity, because of the protein-rich diet, these ulcers tend to bleed. So as soon as there is bleeding from these ulcers, automatically body will form a clot over that stomach ulcer to prevent the further bleeding from the ulcer site. So what happens is we know we have one pepsinogen enzyme which gets converted into pepsin, and this happens at a pH of 2. So when stomach pH is around 2, this there is a conversion of this pepsinogen into the pepsin, and this pepsin then simply is one of the proteolytic enzyme. It means it loves to lyse the proteins, and what it lyses is definitely the clot protein which are formed because of the stomach ulcers. So we know that because of the stomach ulcers there is bleeding, and to prevent this bleeding the body has formed a simple clot, so that this clot has to remain stable and there is no further bleeding. But as the acid pH which is there in the stomach is around 2, this pepsinogen kicks in. The pepsinogen gets activated into pepsin, and this pepsin then comes here, and then it lyses this clot. So there is lysis of the clot. So this ulcer is again open, and this will again bleed into the stomach. So to prevent this, what we do is we give injection proton pump inhibitor in a loading dose, that is 80 milligram of pantoprazole, and we continue injection pantoprazole at the rate of 8 milligram per hour at least for 2 to 3 days. What this does is, it as this is a proton pump inhibitor, it inhibits the H plus ion entry into the stomach acid. So automatically it inhibits the proton pumps. Proton means H plus, means acid in short, which is responsible for the acidity or lowering of the acid pH. Lower is the acid, lower is the pH, means acidic is the environment. And we know that in this acidic pH only the pepsinogen gets activated. So giving this proton pump inhibitor simply increases the pH from 2 to 4. So this is less acidic compared to this is which was very acidic. So we know that this pepsinogen gets inactivated at the pH of 4. It gets inactivated, and as this gets inactivated there is no one to lyse this stable clot. So there is no lysis of this stable clot, so that the clot which has formed over the ulcer is stable, and this will not bleed. So for the firmness, or for the recovery, or for the repair of that clot, it takes at least around 3 days, till that the clot gets stabilized and the continuous GI bleed from the stomach ulcer bleed gets stopped. That is how patients' active stomach bleeding or gastric bleeding can be stopped, and further worsening of the patient's stability can be improved. This is the reason why we use injection PPI on pantoprazole or omeprazole to prevent or to stop the worsening of or the ongoing bleeding from the gastric ulcer. That's for all.